Hi, my name is Dr. Lushine, and I'm an associate professor in the Occupational Environmental Safety and Health Department at the University of Wisconsin-Whitewater. Your professor has asked me to put together sort of a brief summary of about occupational safety and health, I believe, for your course. Hold on. There we go. So this is something that I start all my courses with because I want you to get know me before you start listening to me yap about this. But the way I design my courses are a little bit different. I view your education as each student kind of developing, improving their own learning techniques, developing work ethic and professionalism, and more importantly than that, your ability to take control of your own learning. And that is through documentation and planning and exceeding the expectations of the task. And the reason I do that is because I view all of my students as products that I'm bringing to the marketplace and selling you to the hiring companies. And in doing that, I'm actually taking comments from the companies who interview and hire my students and trying to include those lessons, those characteristics that they really look for in my students. I try to build it into my classes. And so as you listen to my summary here, realize that a lot of it has been built because I actually kind of cobbled together content from other lectures for you today based on those experiences, based on those overall principles. Why are you listening to me? Well, I've got almost 30 years of experience in the safety field. Not too long ago, I was actually out of the blue asked by production crews with ABC Network to manage the safety and health program for a recording of the television show Extreme Makeover Home Edition. This is when I was a professor up at the University of Minnesota Duluth. And these are just a few photos that were snapped during that time. I got a lot more, but it was quite the experience because it was such a, I mean, it was moving at breakneck speed, and there were so many constituents. There were so many phases, and they overlapped with each other. But I built a team, and I built basic principles. And the idea was, we're not going to go around and like a safety cop and tell people you're doing this wrong. We went around and helped people act more safe, behave more safe, use the right equipment. We were there as reminders. We were there as champions. If somebody wasn't wearing something, we would go get it for them and ask them to please wear it. Now, we were given the power. My crew and I were given the authority, to actually kick people off the production site, which was a construction site. So we always had that, but we never had to use it. And in a 7-day period, the home you see in the upper left-hand corner was completely demolished. The land was completely re-excavated, and then we delivered this home you see in the bottom right. And this was a view just minutes before they started practicing the move the bus part of the show. And then this middle crew, yeah, they're part of my group. Whenever you have probably, if in any job you've had, you probably had some training relating to safety and health. And there are lots of banners that I've seen that say safety first, safety first. And I understand the basic principle that they want you to think of safety when you do things, but we don't do that. As humans, we don't. Safety is not first. I dare to say it's never second. It's usually tertiary or incidental, and that pun is intended. The program, a safety and health program, is meant to educate, to influence, to make those aware. But we do realize that rarely do designers, do managers take safety as being first. When you're out working, the work is first. Second to that, it may be trying to satisfy situational or environmental demands or priorities. We should understand that. And when we take that approach, we actually have a much better opportunity to improve safety. And here's the way I view it. This is what I teach my students. Our job as safety professionals is to continuously evaluate the work environment and engage the workers. And in doing so, educate management on what they should be doing, the messages they should be delivering to demonstrate their commitment that workers should do the right thing, which is to try to be safe. But all in all, we want workers to be successful at their jobs. We'd like them to do it safely, and we really hope that they can elicit some satisfaction from the work they do. That's really the principle I use. So I was asked by your instructor, kind of go over some things you should know, because a lot of you are non-safety folk, muggles, so he wants me to or he or she wants me to go over this. So you see on the screen here, and this is the most recent data, which probably is upsetting to you. You probably want to see something more recent to today, but it takes years and years for these statisticians to compile this data and verify it and publish it. What's most interesting, I think, is that over on the right, we've got the total. And so this is the number one cause of death in the United States, based on 2018, was heart disease. Second was cancer, which another name for it is malignant neoplasms. And then third is an unintentional injury, accidents. And that's what that's the soup I swim in. So, but if you look at it, a breakdown by age, do you see when you're under 44, it is the number one cause. And this can be both in and out of the work environment. Because obviously, if you're 1 to 4, you're not working. But accidents, unintended outcomes that resulted in death. So knowing that, sometimes when we get national data, it's influenced by one or two particular characteristics of the group. And that's just something I want you to be aware of. Here's some information from the U.S. Bureau of Labor Statistics. They're kind of the data arm of the Occupational Safety and Health Administration, or OSHA, which we'll talk about later. And so these are from 2014 to 2018. These are the causes of fatal work injuries. And what I want to call attention to is the in first place all these years dominantly is transportation accidents, and that is roadway accidents or vehicular accidents. And you can see it's basically twice what the second one is. So this is like in a tier all its own. So if you want to talk about what causes death in the United States, and we just saw a moment ago the causes of death of younger people, automobile accidents are right up there, whether you're at work or not. So the roadways are probably some of our most dangerous places to be honest with you. And so we have to, one thing is, some of you, we're going to talk about statistics. I'm a big statistics guy, data guy. And things, your age and your gender kind of dictate sometimes how safe or unsafe you are. In general, you look at what you're charged for car insurance. A male, 16, you're going to pay a lot more than a female or someone who's a little bit older, who's a little bit more experienced, because the insurance industries, they use statistics, accident statistics, in order to determine who should pay more, because they're more likely, they're a greater risk financially, so therefore they charge them more. And all insurance is shared risk. It's basically betting that, yeah, something's probably going to go wrong. So next would be slip, trips, and falls. And that tends to be from heights, but it doesn't necessarily have to be. It could be fall under the same level because you fall into something. Contact with objects and equipment. So that can be a range of things, typically with equipment, automated equipment. Next is violence. It can be person or animals, tends to be more person related. It's unfortunate that mass shootings have become such a commonplace in the United States. There's evidence right there of how it's gone up just from 2014 to 2018. Next is exposure to harmful substances. So these can be, and this has actually gone up quite a bit. So these are things in the work environment that make us sick and resulting in death. And then that can include things like silica, which causes silicosis, asbestos that causes asbestosis or mesothelioma, or other agents, either in the products we're producing or as a byproduct of what we're producing, that you get exposed to it and it kills you. And then you look at down here. So this is like a whole tier below what this is, like going from here to here, fires and explosions. But this is what we hear about the most, right? In the news. When there's a fire explosion, we hear about it. But you see, it is the 5th leading cause of death in the work environment, and it's a small part. If we were to stack all these against it, you barely see it on the page. Also from the Bureau of Labor Statistics, these are the events or exposures that led to non-fatal occupational injuries and illnesses that resulted in days away from work. We consider those more severe because what it basically means is a physician or a treating healthcare professional indicated the person should stay home to recover. Overexertion, bodily reaction, it seems to be going down each year. These are ergonomic related, musculoskeletal injuries. Second, slip, trip, and fall. So not ones that lead to death, but injure you enough. Next down is contact with object. So we're seeing some things here. So we had slip, trips, and falls and contact with object as being, in the top 4 causes of death, but overexertion wasn't. But still, it is the most frequent. We'll also see in a little bit it's the most costly. A whole tier down then is we've got the violence in transportation. Isn't that interesting? That transportation is number 1 by a large margin for death, but it's way down here when it comes to non-fatal and days away from work. I just find that interesting. That it's sort of counterintuitive, right? That if there are more accidents occurring on roadways, it would be it would come in first place here with the non-fatal. But no, vehicular accidents, even with the technologies we have today, still result in our number 1 cause of death in the workplace. Interesting. Next, I've got this is sort of the nature or the diagnoses. Sprains, strains, and tears are number 1 because you can get a sprain, strain, and tear, well, primarily from overexertion, but also from falls, also from contact. So yeah, this doesn't really tell us much. I never really spent too much time there. Now let's look at what's costing us so much. And this is from 2019, I believe. The top 10 causes, and these are pretty specific causes, these are not general, account for 85% of everything paid in work comp. Number 1, overexertion. Number 2, fall on same level. Number 3, struck by. Number 4, falls to lower level. Number 5, overexertions. 6, roadway. So what I want you to note is that there is a consistency here. Between the data, there tends to be major causes in all different types of data sets. Here it's broken down by industry. So it's broken down cost-wise. Construction injuries cost the most. They have the most falls. They have the most struck by. Probably the most vehicular as well. Interesting that business or professional business services comes in number 2. That's really interesting to me. You would think manufacturing would because they're a very large amount, but professional business services, that could include a lot of people out, field workers or service workers. It can be people working in offices, and so there may be musculoskeletal. Healthcare, you would think would be a lot higher, and I bet after the previous 2 years with the pandemic that it is higher. They were hit greater than any other industry when it came to COVID indemnified claims. And then you can see the rest here. And then as far as the leading cause of loss, all industries, you see it was overexertion, falls. Okay, so that jives with what we saw before. Construction, falls is number 1. Professional services, falls. So slip, trips, and falls for professional services. Then overexertion, then falls to lower level. They're lower level, struck by overexertion. So I hope you see how, all overexertion is the number 1 in manufacturing, healthcare, retail. That's why it's number 1 overall. Falls the same level, or it's number 2 here. So that's why it's number 2. So you have to, you go from overall to your industry to what your company actually does as far as what are you going to be your major causes of injury and what's going to cost the most. This is incidence rates. This is a number of occurrences per 100 full-time workers. And what this shows is when you have a rate, this is like a risk exposure. So agriculture, forestry, fishing, and hunting, they're at 5.3, even though they only had about in the thousands, about 54,000 cases of non-fatal injury and illness. Whereas healthcare had the highest number, 577,000 injuries. But when you look at the number of people working, it brings it down to a 3.9. And you would think construction would be higher, but construction's down here. Now, how... Sometimes people are like, well, how do you know what's the most dangerous? Well, if the Discovery Channel has a television show for it, it's probably the most dangerous industry. That's not funny. So in safety field, we try to classify causes of injuries, by coming up with theories and models. None of these are correct 100% of the time. And we teach these in our classes just as a way that if you can, how do you want to say this? Create an understanding of the series of exposures or events or decisions that led to a person getting hurt, then maybe we have a chance to go back and alter one of those things or multiple things to prevent it from happening again. And that's really the overall role. But so look at, with this many different models and theories and none of them being 100% right, it really is up to the individual. So things become subjective. Now, the way I practice is I teach a systems approach, meaning that I don't blame the person for getting hurt, though that is actually the default response for most humans. It's called fundamental attribution error. When we see someone in an accident, we blame them because they're most proximal to it. I can see how I would have made a different decision, or I would have done something different to prevent myself from getting hurt. But the person who was actually hurt actually can identify external factors that led to it that was outside of their control. So it's an interesting thing that we tend to blame. And I mean, as sad as it is, even in today's social media driven perceptions, we not only blame, but we elicit some satisfaction when we see someone get hurt. And that's horrible. That's a bad thing. So I never blame the person, because if there's no exposure, they don't get hurt. They can get exposed and actually not get hurt, and then there's exposed and injury. And if we only wait for this occurrence and then we blame the person, we fix absolutely nothing. Because my fundamental assumption is that workers don't do things to hurt themselves. So that's what I believe. So what I do is I try to, when someone, even if there's no exposure, that's the goal. But if they get exposed and don't get hurt, I'd like to investigate what led to the exposure, what led to their perception of what needs to get done, and I study these elements in and around them. And when I find imbalances, that's what I try to correct. I try to realign what expectations are based on what conditions are. I could go into it, but yeah, me and my soapbox. What are safety professionals expected to do? And I don't know if you're familiar with ANSI, the American National Standards Institute, but they come up with these consensus standards that are supposed to guide what people are supposed to be doing. So the role is for safety professionals is to evaluate work practices and conditions, develop control strategies, implement controls and training programs, and then audit what they're doing to see if it's successful. That's all. Nothing on here says prevent all injuries and illnesses, prevent all deaths. It's to continuously evaluate the work environment, try to mitigate those factors that may lead to exposures to hazardous conditions or practices, and then, supplement with training and reminders, and then evaluate the effectiveness. And it's a learning curve. It takes time. Back in 1970, and I believe this was both a Democrat and a Republican, Williams and Steiger proposed the Occupational Safety Act. That act was signed into law on December 29, 1970 by, at the time, Republican President Richard M. Nixon. Coincidentally, I believe the next day he did sign into law the Environmental Protection Act. So once it was signed in, it was called the OSHA Act of 1970. It's to assure safe and healthful working conditions for working men and women by authorizing the enforcement of standards developed under this act, and so on and so on and so on. The most critical of the act, I believe there are 34 elements to the original act, is the General Duty Clause, which is Section 5A1, which clearly states each employer shall furnish to each of his employees, well, his or her, you can tell the timing of it, his or her employees, employment and a place of employment which are free from recognized hazards that are causing or likely to cause death or serious physical harm to his or her employees. That is the General Duty Clause. That is the overarching what employers are required to do. And they can't claim ignorance if it's something that is commonly understood or known. So compliance officers could actually cite the General Duty Clause if there isn't a specifically designed and worded standard that designates what an employer must do. And when I was a compliance officer early in my career, I did use the General Duty Clause from time to time. But I also had to not memorize, but know 80% of the OSHA standards, and I also had access to internal documentation and had to go through extensive training to know the standards. Every workplace, because of the general duty clause, every workplace has to post the rights afforded to workers in the U.S. under the OSHA Act. In addition, it also states the requirements of employers above and beyond just providing a place of employment free from recognized hazards. And it needs to be in a language that is understood by the workers. So I have on the screen here English and Spanish. If you go to the OSHA website, I believe they have 12 other languages listed. That has the same information. Each workplace in the United States is required to have that posted in an area where workers tend to hang out, I guess. Sometimes break rooms, sometimes there's designated billboards, but all workers need to have access to that. Because so much of safety is reliant on the individual making decisions that align with what are considered expectations, standard operating procedures, or policies, I just want to just touch on that subject because I find it interesting. This is the reason I went to graduate school, or one of the reasons I went to graduate school, to study human information processing and behavior. But in addition to that, and I didn't know it at the time, the interaction between organizational messaging and individual decision making, and how that forms risk perceptions and work expectations. I just said a lot. So you probably heard of B.F. Skinner in your Psychology 101 class. He studied how you can extinguish undesired behaviors. And in a way, the safety field has adopted a lot of what Skinner taught, is that we're trying to extinguish the behaviors that would be deemed unsafe or putting workers or individuals at risk of injury. We want to try to mitigate that. And his information processing model is input, processing, output, feedback. And it's this basic premise that he applied, that if we can alter perception, if we can institute a more distinct feedback in response to either thinking or action, that we can help people learn. It really is. It's about learning. It's about learning, and we should support or acknowledge when something correctly is done. And then if something is not correctly as expected or wanted or desired, that we do something about it. It says here, this is a continuous process. I prefer the perceptual motorcycle, and this was taught to me by my mentor, my professor in graduate school, that as humans, we are continuously sensing the environment, and we're using all of our senses. Sight, smell, taste, touch. Hearing, and our sense of balance. Now, whether that information is processed is really up to the individual and what their intent is, or where their attention is focused. If the data gets to the perception level and not completely ignored, then it has a chance, if deemed important, to be brought into cognition, which leads to what we're constantly making decisions based on what our expectation is, what we want to try to do. However, there are limitations in our ability to respond. Not only from a time perspective, do we have enough time? Because sometimes we don't have time to actually, sit back and think about something. We have to react. Those reactions tend to be habitual based on previous experiences. So if we're in a novel experience, or we're faced with a novel risk, we really don't have the background, the knowledge, the wherewithal to make a decision to possibly meet whatever that demand might be. So there's a lot that goes into it, which is why new users tend to commit more errors, because they just don't have the experience with it. So what this really comes down to is, when someone gets injured or they're in an accident, we should not blame them. We cannot, because did they properly sense the environment? Did they properly assess the perception of it? Were they able to compare, think about what it meant and how the outcome might be? Do they have previous experience? All these things were not intentional. They were discrepancies. They were limitations in the individual themselves. So we should not blame. What we should do is try to design feedback and environment so that people can possibly fail, but fail safe. Your instructor also asked me to talk about different types of injuries in different type of industries. Difficult to do. I've got pictures in here of a foundry, an office worker, meatpacking employee, somebody working like in an assembly or a warehouse, construction, and here's someone in healthcare. Basically, safety and health is a consideration or attribute of every decision, behavior, design, and environmental condition. You can act unsafe and not get hurt. You can be careful and still get hurt. That is the basic idea. So wherever you go, there is a chance to get, as soon as you step foot out of bed in the morning, there's a chance to get hurt. Or there's a chance to accidentally get yourself into a situation which exposes you to something that could cause harm. It's everywhere. And it takes time to learn what to do. So to wrap things up, and I'm at about 26, 27 minutes right now. That's what I wanted to do. I'm going to leave you with this message because I could go on and on and on. I elicit a lot of satisfaction out of practicing safety and health, occupational safety and health. I like to solve problems. I like to help people. And it's those two things that really get me excited all the time. So if you wanted me to, I could lecture on this for days on end, because there's a lot of experiences, a lot of stories, a lot of lessons I could share with you. But I'm going to try to leave you with this. What can you do? Ask questions wherever you go work. In addition to, what am I going to be doing? What kind of compensation and benefits am I going to get? Things like that. When do I start? What do you do to protect workers? What are some of the injury or illness cases that kind of stand out in your mind? These are things that are going to get you more aware of what they're doing. Pay attention to rules, signage, and especially while being trained. So many workers are like, oh, this is so boring. Nobody ever gets hurt. I've never been hurt before. You got to listen. They put that together for a reason, and it's usually based on observations and reports within the work environment, especially when you're new. As you become more experienced, hopefully you'll want to contribute to that knowledge of what can harm people, what do we need to do to protect them. Definitely seek mentorship and coaching from experienced coworkers or supervisors. And I brought that up. You're most at risk when it's novel, when you've never been experienced with something before. Seek mentorship and coaching so you can accelerate that learning and understanding of what could harm you, or just to be successful in your job and be safe and elicit satisfaction. Once you've reached that point, look out for others. I'm a very, I don't want to say I've been conditioned, but my career conditions me to look out for risks. I'm very risk averse. I make decisions to try and mitigate myself and my family's exposure to things that could harm us. And I'm not even going to get into it, but there's a lot you can do being aware of what could harm you or what situations, environments are more risky and how to avoid them or approach them with caution. That's all I'm going to say about that. But as you know, and hopefully you get into a work environment where there are mentors and coaches who look out for each other. And finally, contact experts for assistance. I get emails and phone calls all of the time from either people I don't know, just people I've kind of met at conferences or on LinkedIn, former students, just friends of mine reach out to me. It's good to even, if you're not sure of something, or if you, like me, approach things with the attitude of what I don't know. I try to verify things before I make a definitive decision on some big stuff. So your professors are all experts. You should reach out to them. I hope this was helpful. I hope it was a little bit entertaining. And if you walk away with anything, it's that, people make risky decisions all the time and they don't get hurt. What I'm charged to do as a safety professional is to try and design work, try and design tasks and equipment and training so that when people do fail, they don't get hurt, but to also recognize when those occurrences are and see what we can do in the future to continuously improve it, to continue to mitigate those risks, mitigate those strategies to make them more effective. But in addition, make sure the workers are more successful and that they elicit some satisfaction from it. So I just want to thank you and your instructor for inviting me in. I hope this was helpful.